From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, June 3rd, 2020. I'm Cliff Baumgartner. Here's the latest from WREL.com. North Carolina is hitting the mark on only 2 of 4 key metrics in the fight against coronavirus. In a press conference yesterday, Dr. Mandy Cohen, Secretary of the Department of Health and Human Services, said the data the state is using to monitor the spread of COVID-19 has generally remained stable throughout North Carolina's phased reopening, but cautioned that there's still much work left to do. The state is using 4 key metrics to measure how the ongoing pandemic is affecting North Carolinians. 2 of those metrics, the number of emergency room admissions with COVID-like symptoms and the percentage of tests that come back positive, are looking good, showing community efforts like social distancing and wearing face coverings are having a positive impact. However, the number of hospital admissions due to coronavirus are going up, as are the overall number of laboratory-confirmed positive tests. Dr. Cohen said while the increase in positives is partly due to more tests being performed, it's also a sign of more viral community spread. In short, the virus is still out there, and people still need to be careful. Dr. Cohen said North Carolina is continuing to increase its testing capacity, averaging over 10,000 tests per day in the last week. On Monday, the state announced a proposal seeking to partner with minority-owned businesses to increase testing in historically marginalized populations hit hardest by the pandemic. Last night, President Donald Trump announced via Twitter that he was pulling the Republican National Convention out of North Carolina after a week-long back and forth with Governor Roy Cooper. The convention, originally scheduled to take place in Charlotte's Spectrum Center in August, became a point of contention after the president publicly demanded assurance from Governor Cooper that the GOP would be allowed to hold a full-scale event despite the state's ongoing battle with the coronavirus. The convention is likely to draw tens of thousands of politicians, delegates, supporters, and media from all over the country, raising concerns over social distancing and other virus mitigation guidelines. Cooper responded by asking convention organizers to submit a plan for how they could hold the event safely. As recently as yesterday afternoon, Cooper said he had not received that plan. President Trump has insisted the GOP be allowed to hold the event without limitations on attendance or mandatory face coverings, but Cooper refused. Critics of the decision say the RNC would bring a much-needed economic boost to the state, estimating as much as $200 million in local spending for the event. But Cooper's administration has maintained that safety must be a top priority. North Carolina continues to see an uptick in coronavirus cases, and Mecklenburg County, where the convention would have been held, has seen more cases and more deaths than anywhere else in the state. Convention organizers have said they're now looking to other states to host the event, but have not yet named a replacement. Duke University is partnering with the National University of Singapore to create a COVID-19 antibody test that gives results the same day. The test, developed over the last few months by researchers from Duke based out of Singapore, could be available in the United States in the next couple of weeks. It measures COVID-19 antibodies in patients just from a single drop of blood, but doesn't require the live virus. The test can determine whether someone has the antibodies which can neutralize the coronavirus. While there are many antibody tests being made, what makes this one unique is how quickly a patient can get results. The test is already widely used in Singapore. It was approved in the European Union, and researchers hope to get FDA approval in the next couple of weeks to bring the test to the United States. It could be available worldwide in as little as 4 weeks. And lastly, from WRAL TechWire, Burlington-based health sciences company LabCorp has launched a website designed to help people find information about how they can take part in coronavirus research. LabCorp's Covance drug development business has created COVID-19 Clinical Trial Connect, where users can sign up to be notified of studies run by Covance for the pharmaceutical industry, as well as those included in clinicaltrials.gov, a database of privately and publicly funded clinical studies. Michael Brooks, Covance's president of clinical development and commercialization solutions, says the goal of the website is to, quote, link people interested in these clinical trials with sponsors so that together we may find solutions for this global pandemic. Brooks pointed out that hundreds of COVID-19 related clinical trials are already underway or will begin soon. The company says trial opportunities are diverse, and sponsors are recruiting patients who have COVID-19, who may have recovered from the virus, or who may have simply been exposed. You can find a link to the new website at WRALTechWire.com. This has been your Coronavirus North Carolina News Brief for Wednesday, June 3rd, 2020. As always, if you like the information and resources you get from the show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.